Going out and go and you want to pee, you kind of feel shy and you know what I mean? You have to hide and, you know?
And empty the urine.
Empty urine. Understand?
So you had
too much time about that.
in terms of weight.
Waiting.
Oh, the weight is
Too much waiting, man.
So you suggest to the healthcare system and to decrease the waiting time for the procedure they might plan.
Yeah, man. When you could have, you go there and say, all right, come back 6 months time, 6 months time I go again, and tell you, give another 6 months again. How much time that?
Okay, all right.
Get a checkup, you know. Like my age, you're supposed to come and get a checkup, you know?
Yes.
Yeah.
Check the prostate and the blood test for the prostate and the ultrasound.
Yeah, man.
In Office with Dr. Jevon Samuels.
Welcome to another episode of In Office. I am Dr. Jevon Samuels. In Office is a program which we talk about life, sickness and death. And in office with me today is Mr. Berth Williams. Welcome to the show, sir.
Thank you, sir.
Okay, good. All right. So before I get into the interview, as usual, remember to share, like, subscribe, and leave a comment on this video for more informative medical content. Now, today we'll be discussing prostate disease in general, and more specifically, benign prostatic hyperplasia, which is BPH. Right? But the prostate, an organ that is found in men. So it's actually a walnut-sized organ which is between the penis and the bladder. It actually encloses the tube which is called the urethra, which takes the urine from the bladder to the to the penis, to outside. There are three major pathologies or diseases which affect the prostate. You have prostatitis, which is basically inflammation or infection of the prostate. Also have as benign prostatic hyperplasia, which is BPH. That's basically referred to as enlarged prostate. And thirdly, we have prostate cancer, which is actually malignant cells that are forming the prostate, which can then spread to other organs of the body, which can be detrimental. Symptoms of prostate disease. Now we have prostate. This is the organ actually which, as I said before, surround the urine tube which takes urine from the bladder to the outside. So any pathology of the prostate tend to present with urinary symptoms, right? So the organ, if it's enlarged, can cause what we call obstructive urinary symptoms. So you have difficulty passing urine, you have poor urine stream. So as male would know, if you are young, you tend to have a powerful urine stream. But as you get older, then the urine stream tend to be not as powerful as before. So you start to have like what we call dribbling and poor urine stream. Also, sometimes you'll have the frequency or urinating often, especially in the night, which we call nocturia. You could also have what we call hesitancy, having difficulty starting or stopping urination. Some persons may also develop incontinence, while other symptoms that can form from prostate disease, some persons may have blood in the urine or blood in the semen. Others may develop like sexual erectile dysfunction and other things related to sex, such as decreased sex drive, etc. And some persons may have pain, especially in the prostate area, which sometimes on examination, the prostate is actually tender to touch. All right. Now, there are sometimes further symptoms that we'll discuss as we go along with prostate enlargement, but I'm going to leave those for the complications. Risk factors. Prostate disease tend to occur in older men, even though some types of prostate disease, such as prostatitis, infection or inflammation of the prostate, can develop in younger persons that have forms of sexually transmitted infection. Because in younger men, inflammation of prostate is basically mainly transmitted, is mainly caused by chlamydia or gonorrhea, bacteria. So those tend to be the bacteria that affect the prostate in younger males. In older men like 50 and above, we tend to see more organisms such as E. coli may affect the prostate more than the regular STI bacteria such as chlamydia and gonorrhea. Other risk factors, you have males that are older tend to be at increased risk of developing both enlarged prostate or cancer of the prostate. So normally the age of 50, we will start to have a regular screening test for prostate. So we'll have the digital rectal examination in which the doctor actually inserts a glove finger into the back passage and feel the prostate gland. This is actually still an essential test in examination. But we know that sometimes in Jamaica, which we have a homophobic society, then we tend to, some males may refuse this examination and hence sometimes have to use additional tests if they refuse, such as the ultrasound of the prostate, or sometimes definitely we do the PSA. But in general, a part of the screening test for prostate cancer is the digital rectal examination, the prostate specific antigen, which is the PSA, and also the ultrasound, the imaging modality in general. So maybe ultrasound, some persons may choose to do an MRI or a CT scan of the prostate. And those are the tests that we tend to use to screen for prostate disease and also to help make the diagnosis. Now, in terms of diagnosis to rule out cancer, we normally do a biopsy of the prostate gland, and this is actually, the biopsy needle is actually normally inserted from the back passage and takes samples of the prostate gland, and then we send to the pathologist lab for testing to ensure that it's not cancerous. So even though sometimes you might have slightly elevated PSA in some persons, it may or may not be cancerous. Other risk factors for prostate disease, we'll have, like, some persons have family history of prostate cancer at increased risk, so normally encourage those persons to even start screening younger than 50 years old. Also, some they might have some genetic mutation that result in prostate cancer, and also you have definitely like lifestyle changes. So males tend to be obese or live a sedentary lifestyle are also at increased risk of developing both BPH and prostate cancer. Treatment for prostate disease normally depends on the type of prostate disease that they have. So if it's like in prostatitis, then normally treatment would be antibiotics, and that normally would resolve the prostatitis. Now, if it's enlarged prostate, we normally give medication to shrink the prostate, release or relax the muscle of the bladder so that the urine can flow a bit better. Now, some patients, if it's prostate cancer, in addition, they might have surgical removal of the prostate, or some persons may do radiotherapy, some may also do chemotherapy, and in some cases, some form of slow-growing prostate cancer, in older men, they might just simply do active surveillance of it. Now, my guest here is waiting, but I want to make at least one more point about complications. So enlarged prostate BPH, even though it's a non-cancerous condition, can actually have serious complication. You can have chronic urinary retention, in which over time the bladder is distended because the urine stream was poor and the bladder is not completely empty after you urinate. So the bladder is basically the organ that stores the urine after it is produced by the kidneys. So sometimes you might have chronic obstruction and the bladder get enlarged, which can actually lead to more complications as well. Now, sometimes you have what we call acute urinary retention, in which some persons in Jamaica call it stoppage of water, in which you're unable to pass any urine because the prostate gland completely blocks off the urine flow from the bladder to the penis. And hence, it's a very painful condition, and it's a condition which, if left untreated, can actually lead to kidney failure, right? So it can actually cause obstructive kidney disease in which the kidney is actually damaged and may fail even permanently if it's not treated early enough. But my guest here is waiting. So it's a case of benign prostatic hyperplasia, which is BPH, and he's willing to share his story with us about the symptoms and the treatment option that he went through and other factors that affects his life. So Mr. Berth, welcome to Berth William, welcome to the show.
Welcome.
Good. All right. Now, elderly male. All right. So I know that prostate disease is basically disease that mainly affect elderly males. So every elderly male should actually tune into this interview today. All right.
Yeah.
Now, in terms of what are some of the symptoms that you were having before you were diagnosed with prostate disease? In terms of the urinary symptoms, if you had difficulty passing urine, burning when you're urinating a lot at night, etc.
No, because since me have the prostate, when pee at night sometimes burn, you know.
No, I'm asking about the initial, before you had the obstruction, what are some of the symptoms you were having here, from like 2 or 3 years ago?
Yeah.
Take us back from then, when you first. I'm not talking now when you have to treat and everything.
Well, that was alright. It was alright.
Yeah, so what are some of the symptoms that you were having? That's what I'm asking.
Yeah,
the symptoms, like you have difficulty urinating, you're urinating of yourself. So why did you seek medical attention?
Since we have this.
What was happening? You had pain, you could not pass urine.
Why I couldn't pass the urine. But the night when I went to my bed, I was alright. And in the morning, when I wake up,
Yes.
couldn't pee.
So you're just there, would feel the urge to pee, but no urine was come.
No urine.
So did you have like any other symptoms, like you had belly pain or belly
No, only
distension?
sometimes I feel on the navel.
Yes.
Cramp.
Okay.
Yeah.
So you were urinating like extra in the night, like waking up out of your sleep to urinate at night.
Yeah.
Or you have those issues.
Yeah.
Alright. So in terms of screening for prostate, prior to being diagnosed, were you testing like a PSA and getting a yearly checkup?
No, I think me too.
You start to check up?
Yeah, start to check up on it.
Alright. Now, what was the treatment at the time for when you're unable to pass urine? What was done at the time?
When I came up here and told her,
Yes.
I said, I have to go get a tube.
Yes?
Yeah.
So the tube that you got, how long did you have that tube for?
For 2 years.
2 years?
Yeah.
And how often did you change that the urine tube?
Urine tube. Every 2 months.
2 months. So about every 6 weeks there right?
Yeah.
So it's the urine tube we're talking about is the pee-pee bag, right?
Yeah,
they had the pee-pee bag. Now, most persons that tend to have the pee-pee bag and the tube in the penis tend to feel shy going out because of sometimes it may leak out and then sometimes how did you feel going around with the urine bag?
Well, it was a 9. Very 9.
Oh, so
Very
that's some of the issues that they had.
Very 9. That.
How did it annoy you?
Yeah, man.
No, I'm asking you, how did it annoy you? Like, what are some of the stuff that had
If
happened?
going out and go and you want to pee, you kind of feel shy and you know what I mean? You have to hide and, you know?
And empty the urine.
And the urine.
Alright. So say you had any accident like where the bag burst or leak
No,
out on the road?
no.
Oh, so you never have
No.
any of those experiences?
Yeah, never have any of that.
Alright, normally when you have the tube in the penis, you have the risk of getting a urinary tract infection. Did you get any infection at any time?
No,
Infected in the bladder? In the bladder, you know?
no. Okay. You know what, one time,
Yes.
I went one time in Compton tell you that penile going on the back.
Yes.
I tell me that the tube must black.
Okay. Alright.
But since my daughter find out
Yes.
and live in Florida, and leave and came here and said she's going to take me up with her and to bring me to the hospital over there
Yes.
and then look after me. I feel lot better.
Alright. So why did you seek medical attention in the US in comparison to Jamaica?
Well, in the US, I believe they look after you better than Jamaican.
Alright. How so? How so?
Yeah, they look after you in Florida better than in the US better than Jamaica.
What the doctor?
The doctor said.
The doctors are better in the US than Jamaica. I wonder
very, very loving. Yeah, man. Treat you good.
Yes.
Yeah, man.
Alright, so what are some of the additional tests that you did when you went overseas?
Well, the test for them, you know, the drip. You go to bed night time.
Yes.
The drip. And I put it just down upon it up.
Alright, so what about the test that they use to test the prostate, like the biopsy? They did a biopsy over there?
I remember.
Biopsy is when they take a sample of the prostate. They use a needle or they use a little needle that can remove a sample of the prostate.
Yeah.
Yes. So how was that procedure for you? For some persons.
It's sexual, no? But quite okay.
Alright. So you had a high PSA and the possibility would have been, one of the differential would have been prostate cancer. So after that initial high PSA, what was going through your mind in terms of wondering if it's cancer, yes or no?
That's a mass cancer. I must have, I'm concerned. That's why I want to never get rid of this thing.
Okay.
And it happened.
Alright. So when you heard the biopsy result and found out that it was non-cancerous, how were you feeling?
Feel okay. Quite okay.
Alright.
Mm-hmm.
Good. So in addition to doing the biopsy, did you get any medication to take to help prostate?
Yeah, medication. Yeah, the tablet.
How often you took the tablet?
Every day.
Every day?
Every morning.
So did you remember to take a pill every day?
Yeah, that's
No. Is there any case that you didn't remember to take a
No,
dose?
every day, every morning. Every morning I have to take it. 9 o'clock. Every morning take one.
So
I know we still take it.
okay. So what had led you to develop that discipline to take it every morning at 9?
When doctor tell me to write it on the back and say take it every morning at 9 o'clock.
Oh.
My daughter tell me to have to take it
Alright.
every morning.
Good. Now, did they do any surgery on the prostate? Was any surgery done, like they went in, remove the prostate or remove section of it? Oh. So your symptoms were strictly relieved with the medication only?
Yeah.
And then they were able to remove the catheter?
Yeah.
Okay.
And they never tell me to not use the tube anymore.
Yes.
feel quite,
Good.
quite relief,
Okay, good. Now, so you mentioned that your daughter took you overseas. Did you have any additional family support, or your daughter was your main support?
My daughter, man, my daughter.
They can use the opportunity to tell her thanks, big
Yeah, of
girl.
course.
But she will listen this podcast for sure.
Pick up that one girl, man.
So the only child.
No, it was, I was that girl and a boy, but the boy, and shot him, kill him, and what else?
Okay, sorry to hear, man. Alright.
But that, man, it was whole life,
Okay.
Yeah.
Alright. So you're gonna migrate and live overseas, or you're staying here?
But I live overseas.
Okay. You love the healthcare over there.
Mm-hmm.
Alright.
Yeah.
Alright, so
Very much.
Good. So what are some of the suggestions you would give to Jamaican healthcare and the doctors out here?
Well, them still, I wouldn't say bad, they're very good. They're very good at other way, but the company give it too much time, man.
You know what?
And give it too much time out there.
In terms of what? Waiting.
Waiting.
Oh, the waiting is not
Too much waiting, man.
So you suggest to the healthcare system when you decrease the waiting time for the procedure they must plan.
Yeah, man. When you go there and say, all right, come back 6 months time, 6 months time you go again, and tell you, give another 6 months again. Too much time that time.
Okay, alright.
Too much
Appointment.
Too much appointment, man.
Okay, too far apart.
Too far, man.
Okay. And what about in terms of the equipment?
But yeah.
Yes.
Not too bad about that, but now I go through the equipment things, but okay.
Okay.
Mm-hmm.
Alright. So I was listing earlier some of the risk factors for prostate cancer. So apart from the age, do you have any family history of prostate cancer, like your dad or your brothers had prostate enlargement?
No.
So you're the first one to have a urine tube and so forth?
Yeah.
Alright.
First.
What about in terms of your lifestyle? Were you exercising or eating balanced diet?
Yeah, man. Except, man, we ride the bicycle.
Oh, so you're fully active?
Mm-hmm.
Okay, so I guess it's probably just an age factor with you that you actually live a long time. So, alright.
Mm-hmm.
So, but when you were, I still want some experience when you were wearing the urine tube. So there are some of the bad experience you had with it. So it was, alright, passing the tube, it's painful?
Not really, but sometimes it could be when I tube, you don't feel it,
Okay.
Yeah. You don't feel it, because sometimes sometimes if you don't take the thing away, if you're not there until get antibiotic, kind of burning, you know? Yeah. And then that.
Alright.
Mm.
Good.
But anyway, was alright.
Okay.
Mm-hmm.
Alright. Alright, so any final word for the viewers? I think you tell all the story already. Any final word for the viewers, like advice to guys to get checked prostate and so forth?
Yeah. And man, and them supposed to get a checkup, like my age, and supposed to come and get a checkup,
Yes.
Yeah.
Check the prostate and do the blood test for the prostate and the ultrasound.
Yeah.
Alright.
I do real good.
Good.
Mm-hmm.
Alright, so since you have gotten treatment, you're back to your normal lifestyle and you don't have any issues here, you no longer wear the tube, you don't have any symptoms, you only need to take the medication.
And the medication.
Okay.
Yeah.
Alright. All right, Mr. Williams.
Okay,
all right. Thanks very much for coming. All right. All
I
right.
big up my beautiful daughter. Thank her for that, you know?
Yeah, man. All right, viewers, remember to share, like, subscribe, and leave a comment on this video. Until next time, stay tuned for more informative medical content. All right?
Be sure to subscribe for more informative contents on life, sickness, and death.